Well, welcome back. This morning, we're focusing on your health and all the important screenings that women need to know about. So, when should we get them? What should we get? Here are some answers with Dr. Elisa Port, Chief of Breast Surgery for Mount Sinai Health System. Dr. Port, so happy you're here.
Thank you for having me.
These guidelines keep changing, so no one knows when they're supposed to get what screening. So, at what age should we get what screenings?
Perfect. So we start out, some of the youngest screening happens starting at age 21.
Okay.
A pap smear for most women. Then mammograms should start for the general population at age 40.
Okay.
Colonoscopy, the current guidelines are to get it at age 45 for the first one. If you're a smoker, you should consider lung cancer screening with a CAT scan starting at age 50. And bone density is typically done for most women at around age 65 to check for bone health.
So some of these numbers may vary if you have, let's say, a family history.
Absolutely.
Those kind of things.
These are general guidelines, and I think what's most important is that we focus on there's no one-size-fits-all. These guidelines need to be customized and tailored to an individual's specific risk. So a doctor should really do a deep dive with you on your family history. What are the things you're at risk for? And they may be cancer-related. They may be non-cancer related. We know that one of the #1 killers of women is heart disease, not cancer. Okay. And so we have to screen for that too.
We're going to get to all those. I think one of the things people want to get or should get is to get their blood work checked.
Sure.
So first question, when you go say, I want my blood work, is that something you should do annually? And what are you looking for?
Yes, most people get blood work as part of their annual checkup. And these are very basic and easy tests to do. These test for different functions of the body. For example, a blood count will test for anemia. A comprehensive metabolic panel will test liver function, kidney function. A lipid cholesterol profile will help determine heart health. And most importantly, these numbers can give a doctor guidelines and options for intervention to improve health.
Do you have to ask for that annually? Should doctors offer it up, or what should happen?
These should happen as kind of a basic checkup. These are some other tests you do that are really part of basic functions. There shouldn't be a need to ask. If you're getting blood work, this should all be included.
Okay, let's talk about other genetic screenings. BRCA1, BRCA2, you're a big advocate of people getting checked.
I sure am. And what I would say is that around the age of 25, someone should be asking you, whether it's a gynecologist or a primary care doctor, what are you at risk for in your family? It's important to focus on the fact that it's not just breast and ovarian cancer. Pay attention to your father's side of the family. Things like prostate cancer, pancreatic cancer, melanoma. These are red flags that you might have some genetic predisposition and should get genetic testing.
Quickly, let's talk about heart disease. That's the leading cause of death for women. What should women be looking for?
Yes. So, of course, it's primarily symptom-based. If you're having any symptoms, shortness of breath, chest pain, things like that, as a breast specialist, I'm very nervous of people coming in saying, I have breast pain. This could be misinterpreted as heart disease. But for sure, there are risk factors for heart disease as well. They're very well known. Things like obesity, things like high cholesterol, which we talked about with the blood tests, high blood pressure, weight. All of these things are really things where a doctor should then take the next step and can make interventions that can correct these things to reduce your risk.
You're a breast surgeon, and I think what's great is a lot of people feel lost when they get diagnosed. You actually have a book coming out that I think will be super helpful for women who are going through this process.
Thank you.
What is it called and when's it out?
Yeah, so it's available for pre-order now. It's called The Breast Advice, and it's advice for me, but also from my patients who have been through it. And it's available for pre-order now at May 19th. I'm very, very excited to share this information about both breast health and breast cancer.
I think that's so important because people feel lost. That's the first thing they feel when they get the diagnosis. So a book like that would be something very necessary. Thank you so much. So happy that you came to see us.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.